Assalamu alaikum dear viewer, it's me Dr. Ayub Khan. Today we will discuss how we will diagnose a case of diabetes mellitus. As you all know, diabetes is spreading like a wildfire in Pakistan and more than 30% of the Pakistani population is diabetic. We have to be proactive rather than reactive, otherwise things are getting out of hands. Coming down, how we will diagnose a case of diabetes. For this, we perform three important investigations. The first test is fasting blood sugar. If you do a fasting blood sugar on a patient and it is equivalent to 126 milligram or more than 126 milligram, this patient is diabetic. And what is fasting? Fasting is a condition in which the patient hasn't taken food for more than 8 hours. The second important investigation is random blood sugar. If you do this test on a patient and it is more than 200 milligram or equivalent to 200 milligram, this patient is diabetic. The third test is HbA1c. As you all know, HbA1c is a test which shows us the 3 months previous record of a patient. And if this test is more than 6.5% or equivalent to 6.5%, this patient is diabetic. You don't have to do all these three investigations. You have to do only one test out of these three for the diagnosis of diabetes. And if the patient is symptomatic means the patient is having polyuria, polyphagia, and polydipsia. On a single test, we can diagnose a case of diabetes mellitus. Once you diagnose a case of diabetes, then the patient asks a very important question: Dr. Saab, what is my good control? If somebody is already diabetic and if you do the fasting blood sugar of this patient and it comes out to be between 70 to 130 milligram per dl, that's a very good control. If you do the random blood sugar of this patient, it is less than 180 milligram per dl. It's an excellent control. And if you do the HbA1c of this patient and it is up to 7%, it's a magnificent control. But we don't keep a tight control in the elderly and frail patient. Now coming down to a very important area, and this is the area pre-diabetes. If you do the fasting blood sugar of a patient and it comes out between 100 and 125 milligram per dl, this patient is pre-diabetic. Random blood sugar from 140 to 199 milligram per dl, this patient is pre-diabetic. And this is the area we, being a doctor, health worker, we can intervene, because by counseling of about dieting, exercise, and stress management, we can convert these pre-diabetic patients into a non-diabetic patient. So always concentrate on the pre-diabetic patient, because we can intervene and we can convert these patients and we can save them from diabetes mellitus. Thanks for joining us.